Welcome back to another session of Understanding Human Anatomy. In this video, we're going to continue our discussion of the structures of the heart, and we're going to look at the internal structures of the heart. So I took a diagram that we did previously showing an anterior view of the heart and the external structures, and I'm going to cut a window in the right atrium. Like so. See, we'll leave a little bit of the wall showing. And I will, since we're going to simulate cutting it open, I'll just cut that little bit of the wall of the auricle out. And I'm going to fill the area that we opened up with a slightly lighter shade of pink than the one we had in forming the wall itself. So, one of the things we'll notice is that we have the superior vena cava opening into the right atrium and the inferior vena cava opening into the right atrium. And let me put our labels in here. Superior vena cava and inferior vena cava. We have a third vein opening into the right atrium, and this vein is carrying venous blood from the heart itself. And it opens near the opening of the superior vena cava. I'm going to draw in the outline of the opening of the coronary sinus. And then I will color it the same color as we've colored the superior and inferior vena cava to indicate that it is bringing deoxygenated blood into the right atrium. Again, this is the opening of the coronary sinus. And we'll put a line over to it. Then, when we look at the wall between the right and left atrium, that would be right here. This is the interatrial septum. In the interatrial septum, we will see an oval depression. Like so. And I'm going to color it a little bit darker than I did the wall of the atrium, just to indicate that it is a slight depression. This is the fossa ovalis. And the fossa ovalis is another one of those remnants of an embryological structure. The fossa ovalis is a remnant of the foramen ovale. And the foramen ovale was a passageway from the right atrium into the left atrium that upon birth is closed off. And when it's closed off, it forms a slight depression on the interatrial septum in the right atrium. The other structure that we need to talk about is the opening of the tricuspid valve. And I'm going to show a little bit of it here. And we will color that in with a slightly different color. And this is the opening of the tricuspid valve. And we'll draw a line to it. The tricuspid valve is the valve between the right atrium and right ventricle, the right atrioventricular valve. Now we'll move on to look at the right ventricle. And I'm going to do the same thing I did with the right atrium. I'm going to draw a window through the wall into the right ventricle. And like I did with the atrium, I'm going to color this a little bit differently. Let me erase out the auricle. And we'll color this a slightly different color than we did the external wall. Now, one of the things we're going to see right away are the flaps of the tricuspid valve. Tri is 3, cusps would be flaps of the valve. So I'm going to draw in the 3 flaps There are 2 of the flaps, and then the 3rd flap is posterior, so we just see a little bit of it. And I'm going to color those flaps in with the same colors I used in the atrium. Like so. And we're going to see that each of these flaps has some cords running down to projections of muscle. So let me draw in the projections of muscle. These are called the papillary muscles. So I'm going to draw one in here, and I'm going to draw another one in over here, and then a third one lying more posteriorly, like so. And to give these some color, I'm going to color them in the same color as we colored the wall externally, just to give them some differentiation. And then running to each of those papillary muscles are cords. Like so. I'm drawing the posterior in first. And these cords are called Chordae Tendineae. And they are running from the flaps of the tricuspid valve down to the papillary muscles. So let me put some labels into this diagram. We're going to have the cusps of the tricuspid valve, and we have 1, 2, And the third one I won't draw a line to because too many lines in that area. Cusp of the tricuspid valve, that's the valve between the atria and ventricle on the right side. We have the Chordae Tendineae, and those are there. And then we have the papillary muscles, and the papillary muscles are here. Now the papillary muscles and the Chordae Tendineae work together to keep the tricuspid valve from folding inside out and allowing blood to go from the ventricle back up into the atria when the ventricle contracts. The Chordae Tendineae hold on to the flaps of the valve. They prevent them from turning inside out and projecting up here into the atria. The papillary muscles act to take up slack that's created in the Chordae Tendineae when the heart contracts. When the heart beats, the apex of the heart will move toward the base of the heart. The apex moves this direction. That would put slack on the Chordae Tendineae, and a valve leaflet, a valve flap, could turn inside out, something called a prolapse. So the papillary muscles take up that slack as this end of the heart moves this way and keeps the atrioventricular valve intact. The function of the atrioventricular valve is to prevent blood from surging up into the atrium when the ventricle contracts. Otherwise, the blood would just keep moving between ventricle and atrium, atrium to ventricle, and not go out to the body. So the valves are integral to keeping the heart functioning properly. Now, there's one other structure that I have to draw in, and that is a mass of muscle coming from the interventricular septum over to this papillary muscle that is most anterior. And this band of muscle goes right through the lumen of the right ventricle. And let me color that in. The same color as the papillary muscles and the ventricle. This is the moderator band. And the moderator band is part of the heart's conduction system, the conducting system of the heart. And we only find it in the right ventricle. Notice that the thickness of the interventricular septum is much thicker than the wall of the right ventricle. And that's because the wall of the interventricular septum is the thickness of the left ventricle's wall, which is approximately 3 times as thick as the right ventricle's wall. The right ventricle pumps its blood into the pulmonary trunk. And the pulmonary trunk has a valve in it called the pulmonary semilunar valve. And let me give a representation of it here. The pulmonary semilunar valve. And I've just indicated it with the simple valve right here. The pulmonary semilunar valve prevents blood from falling back into the right ventricle when the ventricle relaxes. So it has a forceful stroke going out that pushes the blood past that valve, and the valve opens up, and then when the ventricle relaxes, the blood tries to flow back, and then the valve closes and prevents that backflow. In the next slide, I'll give a better representation of the semilunar valve. Now in this slide, what we're going to do is draw the pulmonary trunk as if we sliced it lengthwise and then spread it open, like so. And if we look at the semilunar valves, they would look like this. Three cusps that are just folds of the inner lining of the vessel, and let me color them in, and they are, when the vessel is rolled up, they all three meet in the middle. So blood can flow this direction, but when it tries to flow the other direction, the valves close and prevent this. So the semilunar valve, like the tricuspid valve, is important for keeping blood moving the right direction all the time. In the next video, we'll talk about the structures we see on the inside, on the left side of the heart. Thank you for your attention.